the government was panicked into taking these measures in the face of a new virus. And yes, it's quite a nasty virus in the same way that flu is quite a nasty virus. But it is clear to me from the evidence that we've got that this virus is not outside the envelope of other years when we have a bad viral epidemic of respiratory disease. It's not outside that envelope. So the point is they were panicked. They went into lockdown on a purely precautionary principle basis. So we didn't know really what the virus was doing at that stage, whether we were frightened it might be bad. We went into lockdown without any assessment whatsoever, as far as I can see, of the effects of lockdown. Nothing was assessed on that beforehand. And that violates a key principle of medicine. And a key principle of medicine laid down by Hippocrates in about 400 BC is first do no harm. So basically, you don't leap in and chop somebody open with your surgeon's knife, and you don't give them medicines unless you know that what you're doing is going to be better for them than what they're facing. And frankly, if you do that, there's a term for that in medicine, and that's negligence. And so I think the government was negligent, frankly, in putting us into lockdown with no assessment of what it would do. The lockdown, in terms of the effects it's had on people's mental health, in terms of the effects it's had on shutting down the health service, and people haven't been able to get access to treatment for cardiac disease, cancer, you name it. If we believe the health service was normally doing anything useful at all, it's shocking, frankly, that we've simply shut it down. There will be a big reckoning to pay for that. A lot of the deaths during lockdown will be directly to do with that. Anyway, there was no assessment of that. And of course, there's no assessment of the economic damage, which is colossal. And no country has ever improved its health by making itself poorer. So there will be direct health consequences of simply the economic downturn, which will play out over the next few years. Now, none of this was assessed. So when people say better safe than sorry, I'm sorry, guys, it's not as simple as that. You have to assess what you mean by better, what you mean by safe, and what you mean by sorry. And if you don't have a clear handle on those words, you should be very, very cautious, in my opinion, before you do anything. The fact is, most people who have this disease are not seriously affected by it. Unfortunately, some are, but the vast majority who are very old, often quite infirm with multiple other diseases. And, one of the things that's come out of this to me is that it's been just about impossible to have a grown-up debate about human lifespan and about death in public. You have ministers claiming that every death is a tragedy. I think anybody who's in medicine, and frankly anybody who's a grown-up in the general public, will know that that's not true. All deaths are sad. It's sad for the person, it's sad for the family. But the fact is, very old people who are maybe very ill in other ways, or who maybe are demented or otherwise infirm, the fact is often when death comes to those people, it's a natural release. It's a release for them and it's a release for their family. And I think to pretend that every death is a tragedy is simply not true. And the fact that government ministers will keep on saying that day in, day out about only COVID cases, for example, not the 9 out of 10 people who died of other things on that same day. But the fact is, it's simply not true and it's not grown up. And I think to have a grown-up response to any threat in the world, we have to be honest and open about it and see it the way it is, not sort of play politics with it and go looking for virtue signalling and trying to have a competition who to be the most caring possible person that nobody can possibly come to harm for anything. Frankly, the debate has been shut down, and our public broadcasters, I feel, have done a woeful job of presenting balance in this and have not allowed contrary views or even perfectly reasonable other interpretations of the data to reach the public, because it's all become about public control. And I think that's a very worrying precedent and a rather worrying response to our government. And what we've had in this epidemic is one particular subgroup of scientists' view of what they mean has simply been bought into by the government. And that's what all these things are acted on. Whereas a lot of other people's views on it have simply been brushed aside. That isn't science. My own view is that this narrative that we've got was drawn up at the beginning. It's incorrect. That this virus, while it's killed people, and for those people and their families and everybody, that's very sad and it's very nasty. But these are risks that we run in life. Life is not a risk-free thing that we do. That we cannot cure all diseases. If you look at the deaths of the last 6 years, 3 or 4 of the last 6 years have been substantially below average mortality, which means that there was, as I say, an overhang of old and infirm people who were waiting to be carried away by the next epidemic. That's not being uncaring or callous saying that. It's just a fact of life. And the fact is, this epidemic came along and it took them away. But it could have been flu, or it could have been a different respiratory infection. It happened to be this one. It's within the envelope of what we normally live with. What's not within the envelope of what we normally live with is the response to it this time. And the response, as I say, I think that would have caused more damage to the virus itself, and more damage in lots of other ways, I say, to do with freedom and quality of life and the way we think about our relation to the state. And I think there's really serious issues that have hardly been talked about at all. but need to be talked about as more and more people realise the evidence of their own eyes that this virus is certainly now, whatever it may have been in the very first week or 2 or 3, certainly now it's not what it's being painted as being. Well, my argument would be, if it's the best you've got and it's not good enough, you should not act on it, because act on it can be much worse than not acting on it. And I think that's what lockdown and all the consequences of lockdown, to my way of thinking, that's what they're proving. That actually taking big, massive, socially disruptive and economically disruptive action on the basis of things that aren't clear-cut is a mistake and is hugely dangerous, let alone being politically damaging and damaging to all our freedoms and, like I say, our relation to the state and the way we think the country is run. So I think we've really opened a can of worms with this one, and I really hope that we can actually learn to have a more mature approach to the relation between science and public policy in the future, and that we can not ever do this again. I think this has been a total disaster. I mean, one of the things that worries me most about it is I think it brings science into disrepute. I think it's going to, in the future, bring science into disrepute. And I don't like that, because as a scientist, I do believe that science has generated great good for the world. It's created a lot of things that are fantastically great to live with these days. But when you do this to people on the basis of science, it's in the same category to my mind as making a nuclear bomb and dropping it on people. It brings it into disrepute. It makes people question whether it's a good idea at all, which is a mistake, but you can see why they would after this. Heart failure or their chronic obstructive pulmonary disease or whatever it was. And very turbulently, they also picked up COVID. Now, normally that would not be recorded on the cause of death. Or if it was recorded on the cause of death, it would be another contributing factor, not the main factor. But because of the sort of hysteria that went with this pandemic, all of those deaths were recorded and written down as with COVID. So I think it's likely that the actual number of COVID deaths has been substantially overestimated. I think it's pretty clear that maybe a third of the excess deaths that we've been seeing in this time due to excess mortality are lockdown related, not COVID related. And I think a proportion of the COVID deaths will be not really true. And then a proportion of the remainder of those will be deaths with COVID rather than that COVID actually killed those people. So I think the actual number of deaths due to this illness will be substantially lower than it seems to be, although it's difficult to prove that now one way or the other, and how will we ever really know? My strong feeling is that this has been substantially over-egged, and when we look back on it, I think the way probably I'd like to phrase it is that we'll be within the envelope of what we normally live with without doing this. In my opinion, this has been humanity's biggest ever, bar none, biggest ever own goal, in the sense that we've caused damage to ourselves. It maybe isn't totally theoretically impossible for us to isolate a respiratory virus, but the reason why we've never done it in the past is because the costs of trying to do that are so enormous that they outweigh the benefits from actually getting rid of the virus. To advise people to do their own risk assessments, and if they think they're at risk for it, do the appropriate thing. Maybe stay inside, maybe do. But the working age population of this country, who are not otherwise ill, the normal, healthy working age population of this country, have very little to fear from this virus. So it seems to be totally insane to isolate and drop down virtually the entire working age population of this country to try and protect a smaller group of people who are infirm, who could take their own actions to do it, and some of whom won't be protectable anyway. The story simply doesn't seem to add up to me. I can understand why governments did what they did. What I'm finding difficult to understand is why they're still doing it now, months after not necessary. And it's like a super tanker. They just can't turn it round. They can't admit mistakes. They can't admit even a change of viewpoint. And the scientists, the so-called scientists, in my opinion, are guilty of, they don't want to face up to the fact that they called this wrong. And they know that they're going to be worried if they ever admit that they made a complete hash of this. So they're never going to do that. They're always going to maintain the story that they maintained at the beginning. Eventually, people will see it for what it was. But at the moment, and for the foreseeable, they're just going to keep on saying that. I think we could believe maybe that social distancing and the lockdown, we could believe for a while that they might have had an effect. I don't think actually there's much evidence for that. In fact, I think there's very little evidence for that. By all means, try and protect the vulnerable sections of our community and give them some help to be isolated a bit more protected. But I don't think we should compel them. I mean, if I'm 80 and the things that make life worth living to me are to see my family and my kids and my grandkids, I'll make the decision about whether I want to go out. And I can't understand the moral equation that said that at the beginning of the COVID epidemic, we should basically ditch everybody who had conditions now that are serious conditions that we were treating well in the health service. We should simply dump all those on the basis of people who might get a different condition tomorrow. why morally is it better to treat those people than the people we were treating? By all means, if we haven't got enough capacity, build the Nightingale Hospital to improve our capacity, get things sorted out. But to stop what we're doing on the basis of something that was supposed to be coming, which then actually didn't come, I can't understand it. And I think fundamentally, from a healthcare point of view, I would describe that as negligent. And I think, again, I feel there should be a reckoning for that. I feel that was immoral, unjust, and wrong.